And here come the.
All right. Welcome, everybody. Menopause Mondays is back in August. I'm so excited. And today's episode is going to be amazing. We have Dr. Simone Van Horne, and guess what? She's going to be talking about what I just absolutely loved your title, Turning Wounds into Wisdom, which I thought was amazing. And when you
Yes.
you sent in your blurb on your Instagram, and I put it in I copied it as well in mine, where when you said, if I knew then what I know now, a lot of pain could have been avoided. There are blind spots in our practice of medicine, and they do have devastating effects every day, even in our own lives. And that really hit
Yeah.
me when you wrote that. I thought that that was amazing because so many of us um, are like that. You know, we think if we knew then what we knew now, we're in our 50s. Had we known that when we were in our 30s or 40s, maybe some things would have changed. So I think this is so let me see if anybody needs to mute. Right, there we go. So we're going to get started. I'm going to turn it over to you and let's go, Dr. Van Horn. It's all you.
Oh, okay. Hi, everyone. I am back. I'm going to do this one a little bit different, really kind of putting myself out there with my journey. A lot of people do find it very strange that an internal medicine doctor would be so interested in menopause and be so much on the forefront. And so I kind of thought it would be good to explain why a physician who's going through lots of the things themselves is a little bit different from a physician who knows about the stuff in theory, right? And so a lot of my patients, when they come to me, they think I really don't know. Sometimes I do share the story that I'm going to share with everybody today. I can share it now because I'm really very healed from that event. Sometimes when I had really broken patients going through menopause, I would share the story to let them know you can come through it, right? That it's hard, right? For some of us, it's quite hard. But the first thing is to just kind of recognize like what's happening. And so that's what I've put here in this, perimenopause and menopause, recognizing it is half the battle because there are a lot of symptoms that we don't really recognize. And so I'm going to kind of take you on a journey back in time with me, right? I went to Pennsylvania Hospital to do my internship and residency in Philadelphia. And Pennsylvania Hospital is the oldest hospital in the nation, and it is the first residency program, and it's probably one of the first hospitals really where they did surgeries, they did like everything. So it's in the old city, and it is a part of the tourist sites that people visit to see, like, what's the oldest library and what did it look like back in the 1700s, 1800s. And we have residents that go all the way back to the 1800s, right? And they put our names up on the wall when we graduate from our program. So this was me here, right? I left as an internal medicine doctor, and um, I was a chief resident. I think I was the first female. I certainly was one of the youngest. I received a teaching award because I do love to teach, right? Which is why I always rush to do some of these things when I'm asked, because I do love to teach. I have a passion for teaching. And I got one of their very prestigious awards when I left, right? And always on top of my game, knew everything. And after I had my first baby, which I had there actually, I realized that I was exceedingly anxious. As a physician, we know everything that can go wrong, right? And when I had my first baby, um, he didn't pass stool for 24 hours. And I thought I was going to die. I thought that he had, you know, I thought of all of these, the anal atresia that babies can get where there's a membrane in front of the anus and they can't pass the stool. And I was thinking about all of these like horrible things, like all of this stuff like just started to like materialize. Didn't want to go out so much like with my friends. Increasingly, I was always a coffee drinker, but increasingly I noticed that I had to have more coffee. And if I didn't have coffee, it was going to be a problem. And I'm sharing my story because I'm going to share it so that I can kind of teach you like what really happens to the body, right? Now, testosterone starts decreasing at age 25. And after we have babies, or sex hormone globulin, certainly in the short term increases, like right after you have a baby. And when the sex hormone binding globulin is produced, it binds up your sex hormones. So your testosterone and your estrogen are all bound up, right? And you don't get, your body doesn't get access, therefore, to the circulating hormone, right? Now, if there's a lot of stress, adrenaline levels increase. And what that also does as well is that it suppresses the testosterone. Cortisol also, we all know that cortisol levels increase when we have a lot of stress. That also suppresses testosterone. The other thing that during that phase of my life, my first baby I had at age 35, and I was called an elderly primigravida. Elderly primigravida means in obstetric terms that you are an old woman having a baby now. And so that's what in terms of your eggs, right? And in terms of your hormones, you are essentially elderly, right? And the obstetricians know this, right? And I knew this. I didn't appreciate, certainly at that time, what the effect would be on my testosterone. I knew about the quality of my eggs, right? So as we get older and more mature, our adrenal glands and our ovaries start producing less testosterone. So as my kids are growing up and they need like all of this energy, increasingly, I don't have all that energy to give, right? Between work and, all of your responsibilities, right? I mean, I did a lot of things, but I could feel it. And I think that's why we're different with the first baby as opposed to the second baby, because hormonally we are different as women, right? I've already talked about testosterone, and I'm not gonna talk too much about that today, right? I'll kind of focus on my journey and teach around that, right? Now, when we go back into the workplace after we, if we do that, right? Whether we do it or not, women who work inside the home have equally as much stress as women who work outside the home. It's just a different kind of stress, right? But as that testosterone is going down, right, your libido is going to be decreasing. Cognitively, we start to decrease. Joint aches and pains happen. We just start much slower. Our moods change. Headaches start to come on, like by the end of the day, sometimes. A variety of things. And certainly in your 30s and your early 40s, this isn't so much your estrogen and your progesterone. This is really your testosterone levels are going down. The other thing that is happening with our environment in general is just the level of stress that there is outside of what we have to do. There is more crime, there's more wars, there seems to be more famines, more earthquakes, more, now we have like COVID-19 that was exceedingly stressful on a lot of people, right? And all of these things are wearing on our hormones, right? Now, for me, after I left the States, after I left Philadelphia, I moved to Trinidad. I was married to a Trinidadian, and I could feel the cognitive changes and the mood changes happening. But I thought it was just that there are always things to blame it on. I just moved from one country. I moved back to the third world. I'm used to things, how things happen in the States. I always had a thing to kind of blame like lots of the stuff on, but I did feel very overwhelmed. I didn't if I had known now, right, I would have probably checked my hormones like right after, because really I moved from the United States back to Trinidad very soon after having my baby. And that would have sent my sex hormone binding globulin really through the roof to make a big change from country to one country to another like that. Um, but we were never taught that. We were never taught that as doctors, the importance of rest. I mean, in terms of like how important it is for a woman to really rest after having a baby. I think I probably missed that class. I don't know, but I didn't appreciate that. But it really is important because it helps the sex hormone binding globulins to go back down to a semi-normal number, right? And if you after having babies engage in too much stress, it really just leaches out your hormones, and your sex and your adrenal, the adrenaline and your cortisol, they go through the roof. And a lot of women have essentially nervous breakdowns, right? Really because of this interaction that's happening. And back in the 1800s, they recognized that women were going through things like this, and they call it a nervous breakdown, and they would have them go somewhere just to rest, right? And the rest would do them well. And the rest would do somebody well, because if you just go into the country and be around trees and be in some sunlight and stay away from like too much drama, all of those things actually do come back into being, right? So I was in full-fledged menopause like after my first baby, and totally missed it. Was exhausted. Libido was probably non-existent. I really felt like I was having an outer body experience. And when women tell me that they feel dead inside, dead inside should be kind of like it should be a symptom that we put in medical books, as far as I'm concerned. Because when a woman tells me now that they feel dead inside, I know it's more than depression. And it's a very it's a feeling that only women who have this can really understand, right? Um, at this phase, when you start feeling these kinds of symptoms, very moody, very irritable, people are complaining about you, can't get along with anybody else, it's very important to be aware, to be self-aware. It can't be everybody else all the time. And at this phase, I should have had all my hormones checked. We never learned that in medical school, any at all. I don't even think the obstetricians learned it, because my obstetrician missed that as well. Um, Postpartum depression is more on the radar, and there is some overlap with it, right? But if you don't qualify for the depression, then very easily women who are having perimenopausal issues are going to get missed, because the testosterone lack really mirrors a lot of depression, right? So you could find that you go on an antidepressant, which I did, but it didn't take away a lot of what was happening, right? Ashwagandha definitely should have been something that I should have known about when I was in medical school or in my residency program. That decreases your adrenaline, and that decreases your cortisol levels. Vitamin D is also very important. Vitamin B12 is very important. Optimizing your folate and optimizing your thyroid. All of these things are really important. So after I got to Trinidad, I really went through quite a bit. I had a miscarriage. Miscarriages are also exceedingly stressful for women. Miscarriages also in their own right cause sex hormone binding globulin levels to increase. And that's whether you've had a miscarriage or whether you've had an abortion, right? So they're equally as disruptive to a woman's psyche, a woman's sense of self, a woman's, when you feel a baby in the belly, you already have bonded with that baby, right? And when you lose that baby, it is a grief process for women, right? Luckily for me, a lot of people didn't know that I was pregnant, except me and my husband at the time and my obstetrician. But even as I lost that baby, I could feel that there was something very different happening in my body. It's like I couldn't stop crying, couldn't stop grieving. And not to say that the obstetrician was insensitive, but he like when I had to end up having a D&C, and when I woke up, I was still crying. Like I woke up out of the anesthesia, still bawling. And it was like, Van Horn, I don't understand. You know the statistics, like you know the numbers, like you're gonna be able to have another baby again. Like this just happens. But really, I don't think sometimes as doctors, like we are in this thing for such a long time that we forget what it feels like to be on the other side. It's kind of good as doctors for us to be on the other side, because it really doesn't matter what I know in theory. It doesn't matter. I was the best medical student. I was the best intern, the best resident, got all of these awards. I knew, yes, I knew, but it didn't matter. And my hormones didn't care either, right? They were going off the scale. Any event, after I had the miscarriage, I think things just took a major turn for the worst, right? And I couldn't stand Trinidad. I just couldn't stand. I couldn't stand anybody. I couldn't stand anything. I hate to be back in the West Indies. I was like, I'm going back to the States. It's going to be so much better. Well, it was not so much better, because it was not about where I was living. It was about my hormones were changing, and what I was feeling like inside. I was feeling dead inside, and the other thing I was feeling was like I could only explain it as I felt like I was in like the tumble phase in the washing machine. Like I was just tumbling inside. And as a physician, when you start to feel things, you try to like figure it out, like based on like what you have read and what you've seen in your practice. And as I said, I was on antidepressants. It wasn't doing a thing, right? And I was wondering what the hell is going on with me. Anyways, I checked my vitamin levels, and my vitamin D was low. My vitamin D was critically low. My vitamin D was like 9 or 10 or some ridiculousness. And this is somebody who loves the beach. I love to be outside. But that's how hard I was working, and that's how much I was not getting an outside. And it showed in my vitamin D levels. So with my patients, I'm really anal about vitamin D levels, because to be honest, when I did take the vitamin D, I did feel a little bit better, but I still knew something was not quite right. Anyway, so fast forward now, I'm like 39, 40. I've gotten divorced. Like that's how bad my perimenopause was. I wouldn't say it was just that, but I think what happens is that during perimenopause as women, it gets to the point where we just, they say, okay, you're just not taking any foolishness, but it's more than that. It's like a super sensitivity, and you just don't have the patience. I didn't have the patience anyway. I didn't have the patience for a lot of things that I had patience for in my 20s and my 30s. And now that I had babies, I thought I had the right to be impatient, because I have kids now. Like let's grow up. Like everybody grow up. Like, let's all grow up. Anyways, so I'm in the States now. I'm back in the States, and I'd moved to Florida by this point, and I was at the hospital. And I had made now another move. I'd moved to New York initially, and then I then moved again to Florida. And I'm not a person who really likes to move, although I've found that I've done it quite a bit in my life for whatever reason. But moving again was just so exhausting again, right? And when I moved, I started working, I think within like 3 days of moving. So I didn't even have time to settle. I didn't have time to like really unpack everything. I was just like in this stress state. Like, you as women, we leave work and we come home and the house is still not unpacked, and it just stresses us out. anyways, I go to work one morning and I'm having a lot of coffee these days now. Like in my early 40s now, coffee in the morning, probably 2 cups, like by 2, 3 o'clock, I can feel like, something waning. And if I have to do a night shift, I have to have coffee all through the night. So I had my period one morning and I again felt that I kind of felt like that kind of outer body experience where like I just feel disconnected. I could feel the disconnect inside of me. My son was he had a cold. I think he had a cold. The cold was going, but I wanted him to just sleep because get as much rest as he could. And I lived at that time like 5 minutes from the hospital, and his daycare was on the hospital grounds. So I was like, let him just rest. I'll come back for him in between patients, and I will get whatever I have to get done. So I went and saw patients. I came back when my nanny told me that he was awake, and just like many other days that had happened before, I was taking him to his daycare. I went to work. While I'm at work, I heard over the speaker, Dr. Van Horne, can you like come down to wherever? And we need you like stat. And I'm like, everybody needed me stat that morning. First of all, I woke up feeling like I was out of body. Everybody needed me stat. The nurses needed me stat. The patients wanted to leave stat. Everything that probably could have gone wrong, like just on a day, was going wrong, and I wasn't feeling well. Anyways, I finished discharging a patient, and I went to the elevators, and the security was there, and he was like, Dr. Banner, we have been trying to find you all morning. And I'm like, I'm sorry, I was just trying to finish off my discharge. He said, you left your child in the car, and somebody passed by and saw your child in the car. So needless to say, he had to almost like hold me up, because that in of itself, right? Like that was like my whole world really just kind of just imploded just in that instant. I went down to the chief medical officer's office. There's all this police there. This actually happened at a time where a lot of people were leaving their kids in the car. And there was a lot of judgment that was going on about these parents and quality of their parenting and who they were as people. And it didn't occur to me in that instant, but the police intensity was there because that was happening. And I don't really remember that day, to be honest. I don't remember a good amount of the day. I do remember the police. I do remember calling like friends some of my friends are attorneys. I do remember calling the father. I do remember just crying. And I think because I was in such and whatever I was saying, like as I was crying, because what it was that I was really stressed out that morning. I think the police understood like what was happening, but also present there were doctors, and none of them looked at the situation and said, this is just not even her. Like nobody said that. I had to leave. I had to take time off, and I had to have like psychiatric evaluations, all kind of thing, and like mandatory time off. And I passed everything, as I always do with every test. Passed everything. Nobody could figure out what it was, right? They just kind of chalked it up to just being stressed. And I mean, I understood that I was stressed, but I had been under worse stress than that. And I knew deep down inside that there's something really wrong. Like there's something really wrong. And by this point, I'm a doctor. I'd done every single blood test that I had learned to do, right? So every vitamin is fine. I'm on the medicine for my mood, right? My mood is actually fine. It's just I just don't feel like myself. And so when women tell me that, I'm exceedingly sensitive to it right now. I don't blow it off at all. And when women tell me that they forget things, to be honest, nobody has forgotten quite like I forgot, right? So I before I thought it was just devastating, but like today, I kind of feel very privileged that when women are um feeling their worst, like when they've done something stupid, because now, you know, if another time I've shared the story a lot more often, now women share with me a lot more often. Like sometimes they're so embarrassed and they don't want to go through that judgment that I kind of went through. So with some people knowingly and some people unknowingly. A lot of people were judging the people who left their kids in the car and they didn't know it was actually happening to me. And at that time I was feeling so ashamed. I wouldn't say anything. Anyways, I was in perimenopause and I didn't know it. Just walking around feeling completely empty, um, exhausted to the point where like my poor kids, I was just like, they just knew me as sleeping. I was just sleeping. If I saved it all for work, and then when I got home, I was sleeping. Anyways, a friend of mine who had early menopause, she was a part of a support group. She's a friend and a patient. And she sent me some lab work and she's like, Simone, look over this lab work. I got pelleted. And I'm like, pelleted? And she's like, yeah, I got my hormones balanced. And she had gotten testosterone and estrogen. And I was like, what kind of a witchcraft are you doing? Like, why are you taking testosterone? Like, what's doing? So again, we don't know anything about this in med school. We don't learn about the importance of it. To be honest, the psychiatrists, when I mention it now to my psychiatry colleagues, they all know. They also don't check for testosterone, even though they know that it can do all of these different things to people's moods, people's cognition, to all of this stuff, right? Or if you have mood disorders, it can make it much worse. And one of them said to me, I don't know why we don't check the testosterone. And we really don't, because it's not, there are certain things that insurance companies will pay for. And there are certain things that they won't pay for. They won't pay for a lot of times for testosterone. And unfortunate thing is that is what actually translates into our practice, that we try to figure it out without that. So we don't really see what are the trends that are happening with people. Like now that I check, I am like shocked, like not only as to how many people are deficient, but even the how young people are who are deficient in your 20s, right? When you're supposed to have the most testosterone you ever have in your life. Like now that I'm checking it, I'm like, this is an epidemic almost, right? And now women do share a lot of the things that they forget. Sometimes they forget their dogs, like, out, and they feel very, very, you know, bewildered as to how this is happening. And at least now, having gone through the worst of that, right, that I can say, you're going to be okay. My friend who did share with me, I was as a physician watching her moods, right? And yes, talking to she was in menopause, and I was looking at it and saying, yeah, she's in menopause and she's having a rough time. I had learned in medical school that hormone therapy, unless somebody was like really, really like they can't get out of bed and the hot flashes are so intense, that it was something to really just kind of stay away from, right? And really what we learned about in medicine was synthetic hormones, right? Pills, injections, and I knew the side effects of those things, and I wasn't interested really in exploring that. Having said that, I got a lot of signs from people before. A lot of people like ask me, why don't I go into hormones? Why don't I a lot of my patients would ask, why don't you check my hormones? And I was like, what am I checking your hormones for? What am I going to do with it? Because I'm not going to put you on these tablets because you're not that bad, right? That was my thinking as a doctor. And for a lot of you, that is actually their thinking as physicians as well. They're trying to really protect you from the side effect that we do know, right? And I had fibrocystic breast disease. I wasn't interested in taking any birth control pills. And I really had no sex drive. And I knew that the birth control pill messed with my sex drive. I didn't know the direct relation to testosterone, but I knew, knowing myself, that taking the birth control pill did make me feel like that. In any event, I was uncomfortable with hearing about this pellet stuff. So I asked for the rep who of the company to come to my office and explain what the evidence is for what my friend is doing. Because to be honest, I thought I had to save her. I was just like, what are you doing? What do you mean? What are you doing? Right. And I thank her to this day because she taught me something, right? Really opened my eyes. I was able to meet a lot of other physicians who really came out to that traditional practice of that kind of medicine. And now I have a whole bunch of colleagues who think differently and think the way I would like to practice medicine. I got my pellets probably 4 months after that, like after I really went through like all of the research and um, scrutinized like everything, and I got my pellets, and it took me a long time because I was really low. I was really, really low. My sex hormone binding globulin was through the roof. So I was low, and on top of that, my sex hormone binding globulin was high. So my cells were I was basically operating under with none, really. Um, I had really bad hot flashes, which is really why I did it. I thought, by the time I got to menopause, it was kind of obvious that, like, yes, hot flashes, whatever. But I wasn't putting that dead inside feeling and the cognition that I was having since perimenopause. So no, for like maybe 8 years before, I've already been having like a lot of bad symptoms. Um, and once the hot flashes did go, the energy that came, the cognition that came, the ability to multitask again, the ability to leave from work and go home and do more things. Like I go home, be cleaning up, have dinner with the kids. And I was like, what the freak is going on? Like, this is what I have been lacking all this time, right? Like it took, menopause to come for me to like really figure out like that I wasn't perimenopause. If somebody said to me, what was your perimenopause like? I would have said, I didn't have any hot flashes. That's what I thought perimenopause was. Like just hot flashes and dry vagina. I didn't have dry vagina. So like I thought I was good, right? And now after doing so much research and now after treating so many women who now open up and tell me their stories, right? And now after saving quite a few marriages actually, right? Because the same process that is happening with women is also happening with men, and it is a disaster zone when both people are lacking their hormones because they just can't meet, right? And now after going through, a lot of, even before I realized it was my hormones, I realized that there was something wrong. And from a spiritual standpoint, I decided that, fasting and prayer would really be how I would contain a lot of what was happening, just to kind of be centered and to be aware and to be present, right? After the incident happening with my child Dominic, I concentrated a lot on that. So I really I'm very good now at controlling my emotions. I very rarely, even before I got the pellets, would get upset with anyone. Um, I learned to do that. But once the pellets came in, it was easy to do that, to do it. It didn't even occur to me sometimes to be like irritated and go, Simone, no, just leave it alone. Like I did, those thoughts never came to me anymore. I just naturally just didn't care. I just naturally just was like, so big deal. So a lot of things were like the water off of a duck's back. And I think this is, it's important for me to tell the story because when I'm on social media and I'm putting out all this stuff, out there. Like I think people think I'm just trying to sell it, like I'm a rep or something. That's what somebody like said to me that's how I kind of come across. And so it's really important for me to kind of tell the story because the reason why I go as hard as I do and try to explain it in as different ways as I do is because of what I have gone through, right? I could have lost my whole profession, right? Had DCF at my house, tried to come and see if I was abusing my kids, and it was just horrible, right? I can't even. That time was just so horrible, and now when I hear on the news that somebody has left their children in their car, like that's the first thing that kind of hits me. Like, what is this person going through? What are they there? Was their glucose okay? Is their vitamin D okay? Are there all their vitamins? What are their hormones like? Are they going through this? What I was going through. I don't judge. As a physician, because we've seen so many things as doctors, I already had that kind of temperament where I didn't assume the worst of anyone, right? But after this, it really has just completely changed the way I look at people who forget things, who have memory problems. It makes me look at fights that women and men have completely different because I'm looking at it really from a hormonal standpoint or a depression standpoint. I'm not looking at it as like you are a nasty person standpoint, right? And you know, I think that's what I wanted to do with this lecture today is kind of teach around myself. Like in medical school, we would have patients that would come in and we would learn around them. And so today I'm the patient, right? And I want you guys to learn and extract as you see people around even who are kind of struggling to not think the worst, right? Because it's a feeling on the inside that is unexplainable. And even as I'm sitting here today, having gone through it, I can't explain. It's just an empty feeling. It's a feeling of like you're dead. Like you have lost your fire, your whatever that thing is, that joie de vivre, right? Like and to get that back, I mean, the patients who I do have, like, who are really low, you can see that as a physician, like that's the doctor-patient relationship that I really always wanted, right? So it's a really good fit for me because I get to really explore people properly and explore their symptoms properly, which was one of the things that I was kind of showing to you guys. I kind of passed over it, but when I'm asking about your exhaustion and your sleep problems and your irritability and your decline in zest for life and your joint symptoms and your sweating and the headaches and the weight issues, like a lot of people don't really even think that most of those things, anything can be done about, especially when they're already on an antidepressant, right? So that's my story. And let me come to the end here. I'm going to open up for questions because I'm sure there are questions.
Definitely. Wow. Simone, that's amazing. I think your vulnerability and your real story has definitely moved me without a doubt. I'm sure it's moved everybody. But to hear a doctor be real is that doesn't happen very often. That doesn't happen often. In my opinion, I've never seen it. So I really do appreciate you coming on here and being vulnerable. So yeah, Naps, do you have anything? And anybody, ladies, if you have, please pop your questions in the chat or open up your mic. I don't think we have too many. So
I just really wanted to echo what you were saying, and thank you, Dr. Van Horne. You had me in tears over here. So much stuff that you don't know. I mean, I've been driving somewhere and not all of a sudden not knowing where I'm driving. And I've just had to stop and go, okay, there's kids in the back of the car. Okay, they're wearing a school uniform. I must be on my way to school. Like I've had a morning like that. And I had no idea that that miscarriages and that whole situation there and all that transpires after has such an effect on, and that to me, like, not to spill all of my beans, but that explains a whole lot about stuff that I've observed in myself. And even who doesn't have a friend that has had a child and all of a sudden you're like, I don't know who this friend is anymore, right?
Yeah.
So this information is so important to be getting out. And I just want to say thank you. Thank you for sharing, and thank you for continuing to get the information out, because we don't have to suffer as women. We really don't.
Yeah. Yeah. Yeah, but we don't know, and doctors don't know either, right? So it's when I'm doing it for both, I'm sharing for both my colleagues to see like how when we have blind spots, it's we hurt our patients and we hurt ourselves, because at some point we're all going to become patients, so it's important to I mean, I'd like to thank Shani. I don't know if she's on here or anything, but I'm sure she's probably here. But her being vulnerable, and when I came on Instagram, a friend of mine showed me her and said, Simone, you can help her. Somebody who I had also helped, and I could hear the cry for help, right? Like, because having been through it, like once you go through it, like you can actually see it in another person, right? Without them even having to say very much, right? So I figured, if Shani can have 200 and something thousand followers and be telling them the whole of our business and helping, I mean, that's the other thing. The help that she is bringing to a lot of these women's lives and don't know them. And I'm a physician. I'm supposed to be healing people. And, when women are like really broken at this time, that's the least I can do. Now that I'm healed, I couldn't do this probably 10 years ago or 8 years ago, or, it takes a while to kind of get to this point. But once I have now understood really even the science that is going on inside of me, it's really allowed me to give myself more grace, right? Like that I am human, and that I am a patient as well, right? And it helps me every time I can help other people with the story, right? Because then it gives that horrible thing meaning, and I think that's the phase of life that we're in. We're just kind of trying to leave the ugly and come into something new,
Well, I totally agree with you. And I mean, certainly women at our stage, I always like to say it's an evolution. We're constantly evolving from, who we were in our 20s, 30s, 40s, 50s, and forward. And each day, I think that we're evolving into something, someone, something new, and being able to have that awareness of, as you said, something is off, something is wrong, and own that and go into it rather than nope, and putting it off, I think is where the power for us as women lies. That is to own that awareness. Hey, shit, something is just not right here. I need to do something about it. And if the first doctor doesn't listen, you go to the next doctor, you go to your girlfriend, you go to, as you said, your friend is really who basically saved you with the pellets.
All right. Yeah. So, and there's another thing. I mean, as doctor, you say like there are not too many doctors like me. That's true. There are not too many doctors like me, but I'm doing it even for them to be like, sometimes our patients can teach us so much. Sometimes, yeah, we have the Google doctors who, may not know what, everything that you're talking about with what they saw on Google. But every now and again, it happens quite often that a patient will teach me something that I never knew, right? And it just requires humility, you know what I mean? Because I don't think any of us know everything, right? And certainly, I mean, I want to tell you, she opened up my eyes not only to the treatment, but as I said, to a whole bunch of other colleagues now who I can lean on and discuss things with, right? And yeah, so
Learning from each other, and this is why we do what we do, is women supporting women, is because we don't have the answers. None of us have the answers. So when we lean on each other, the answers do always come through. We don't know everything. So it's women supporting women because we're on this journey together. So I love that. I
yeah.
love it. So we have a question here in the chat. Genevieve, I'm not sure if I'm pronouncing it right, says the pellets are in for 3 months. What if it needs to be changed dose-wise within the 3 months? Is that possible? Or that there is a potential adverse reaction, which is possible? So let's stress the
Well,
first part. They're in for 3 months. What if they need to be changed or the dosage or something is not right within that first 3 months?
so what we do with the pellets is we give you the lowest dose possible. So that nothing would need to come out. We might need to put a little bit more in, but nothing would need to come out, right? So that's the first question. And it can be there you can metabolize it for more than 3 months actually. I have patients who are at 6 months, like my older patients who get it. They're not doing too much other than golf. They might play a little cards in the afternoon. Those are my retirees. They have it in their body for like 6 months before they need more, right? Somebody who would need it after 3 months, I would say that person is like either you have premature ovarian failure, like Dr. Swaby had shared with us, or you will have a very, 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 very active and stressful lifestyle. Like you are, you work out, you're a bodybuilder even. You're a bodybuilder and you have you work some night shift or something, like maybe or a firefighter or police, like they tend to be like 3 months like on the dot, or on the 4 month mark, those kinds of jobs. But most people be like about 5 months, right? 4 or 5 months. And we might need to add a little bit more, but we will never need to take out any, because I'm giving, when we're dosing it based on your age, your weight, and where your levels are, and we're putting you back to where you were in your 30s. Now, the other thing about the pellets that I administer it's bioidentical, so you can't really be allergic to it. It's kind of like saying a diabetic is going to be allergic to insulin. It really doesn't happen. Putting your hormones back to when you're in your 20s and your 30s may bring back things that you had in your 20s and 30s, right? So if you had endometriosis, I may have to dose you even lower for the estrogen, because if you still have endometrial deposits, those could get active again. If you have fibroids, I need to dose you. I need to know that I dose you very, very low, because your fibroids could start spotting and you could have a little bit of bleeding, right? So I need to know like all of those medical conditions to really know how to dose you. People who had acne, like when they were in the 20s and 30s, we tried to dose a little bit lower, or just to see if, the acne will come back. And some people it doesn't come back, and some people it does come back, right? And we might have to treat you for acne again, like we did when you were in your late 20s, or teenagers years. Not too many people are like that, but you have the odd person who is like that. So you don't have allergies, but you do have things like that, right? That as doctors we will have to deal with. And for the patient who's on the journey, they're going to have to make that decision. Are my symptoms bad enough that I want to do this, right? For me, it's kind of a no-brainer, no pun intended, but I was like, once I saw the research and I saw the issues with the cognition and that they call it zest for life. I call it dead inside. That's what it feels like to me. Like you just don't want to do nothing. You don't want to see nobody. My friend would call me, you want to come over? Right? Like it was, once I get home, and everybody's like that to some extent, but I knew that I was just a little extra with it. Like this was just not normal, right? And so for me, what I feel like with the pellets, it's not negotiable at this point. That I won't have it unless I can't have it because I have some kind of hormonal cancer, right? But knock on wood that doesn't happen because I feel like night and day with it.
Good. Good. No, that's very powerful. We have another question. Vanessa is asking, can you get a pellet with all three hormones, testosterone, estradiol, and progesterone?
No, the progesterone doesn't come in a pellet. It can't be absorbed that way. The progesterone has to be taken by mouth or by vagina. They have pessaries that you can take by vagina. Women don't really like having to take a pessary every night. They have that you can put them under the tongue too. Troches that you can put under the tongue. But the fantastic thing about the progesterone is that it does help you to relax and it helps you to sleep, like if you have insomnia issues. So even the insomnia stuff is a hormonal imbalance, and progesterone does help to reset that.
Okay, that's great. So progesterone is by tablet, but in the pellet, it would be the testosterone and the estradiol.
Right. Yeah. Yeah.
Do you ever do pellets that are just testosterone?
Yeah, if a woman is still menstruating, so like but if back then I should have had a testosterone pellet because I was still having my periods. My estrogen was okay, but my testosterone was like plummeting, like with the stress and with the moving and with all the different things. So yeah, so if you are having periods, then you don't need estrogen or progesterone. Your body is still doing that, so we don't mess with that. You get the testosterone alone. And when your estrogen starts to go down now in menopause, the testosterone gets metabolized into estrogen, so your menopause won't be as horrible, right? The hot flashes won't be as horrible.
Okay, that makes sense. Okay, so that goes into a question. Sorry, Natalie. Yeah, what age do most women use the pellets for or to?
Yeah, most women, I would say most women would be in their 40s, but I'll stick a pin with that as I'm pelleting younger and younger women, like in their 30s even, because of the stressful lifestyles that we're living. So and some women have a lot of their kids earlier, right? If you have a lot of kids early, or if you wait too long and like me and you have the kids like late, then whatever little testosterone you have, it just gets leached out. And then you have some women who have, if you have 4 or 5 children, it's a lot of stress. Like if you have 5 children between, 22 to like 30, your house is always busy. There's always things that you're doing. I personally can't even imagine. So those women also come with very, very, very low testosterone, especially if they're also working. Like, it's a lot. It's a lot to work outside the home and maintain a house and be a good mother. It's just, this is the reality of what feminism has brought to us. And to be honest, I don't know if it has done us all a great service, because I don't have a wife. If I had a wife, I'd have somebody to make me do some of the wife things, right? But when we went out the house and we decided that we wanted to be that did not come with a wife. So, you know, the things still need to be done. That's the
Yeah,
reality.
wrote it out. What about women over 60? 60 and over.
60 and over, they can't, to be honest, the women who are 60 and over, I lean more towards just giving them testosterone as well. Usually those women have cognition issues, they have pain issues. I have, as I told you guys the last time, my oldest patient is 98 years old. She's going to be 99 this year. She had severe pain, couldn't get out of bed, didn't have any appetite, was sleeping all day. After having worked until she was 97 years old, like she was still going out to the police woman and she was still going there and doing volunteer there and whatever. And I think she got COVID. I can't remember what happened. But then her testosterone, her hormone just took a complete nosedive. And we gave her back and she started going back out again. She's, volunteering again. She goes out and plays. Her appetite came back. Everything just came back, right? So a lot of the things that we're kind of struggling with, yes, it's old age and yes, like, okay, but a lot of it is actually hormonal, right? That we're losing the hormones and they're not where they should be. And it does have quite dramatic effects.
Dr. Van Horne, correct me if I'm wrong, but did I hear you say that as women, if women still are menstruating, they don't necessarily need to be on estrogen and progesterone?
They don't, period. I mean, they don't.
Okay.
If you're on a birth control pill, that's estrogen and progesterone, but your body is still making estrogen and progesterone until you go into menopause, until the period stops.
Okay, so for that perimenopause space where you're not feeling quite right with all of those things, so you use them at that point to support, you're only using testosterone?
Just testosterone. And testosterone, if let's say that as you get close to menopause, your estrogen starts dropping and you get hot flashes. If you're getting testosterone, that won't happen to you because testosterone metabolizes into estrogen. So you'll never really have that big drop, right? Like, so yeah.
Is there a period after which a woman has been in menopause that taking hormones does not make sense? Whether it's 10 years since the last menstrual period or 5 years or a year, where does it not make sense?
Well, if you're going to do synthetic, it doesn't make sense after 60, right? If you're going to do bioidentical, you can do it at any time because it is the same as your natural hormones, right?
Okay.
So, yeah, they're elderly people who are still taking their hormones. I don't give a lot of elderly patients the progesterone and all that. I might give the progesterone to help them to sleep, and so they don't have to take like sleeping pills and stuff. But the estrogen, that I have to kind of like weigh, right? Because the estrogen is really going to help for the most part the hot flashes. In terms of symptoms, but it is going to help with if they have bad osteoporosis, then estrogen, I might want to put estrogen on because I know if I have the estrogen and the testosterone, that's going to be reversed in 3 years. If they're starting to have cognitive issues, estrogen also is as powerful as testosterone. Testosterone is the one that is really affecting the perimenopause, but when you lose the estrogen in menopause, you need the combination of both. So every patient is different, and we sort of come up with it together. But in theory, no, you can get all three. If for bioidentical hormones, you can get all three. For the synthetic ones, no, like those tablets and like all those other the injections, those things, then no, after age 60, if that's the only choice that you have financially, then no, it doesn't make sense to put yourself, I think, at that kind of risk.
Okay. Thank you.
I have a question. you talked about checking your hormones, and I think that's very important. I mean, I do think that, we go for regular blood tests to check all of these things. And I'm an advocate, of course, for women at this age that they should always just include the hormonal panel in that as well. So I always, somebody says, oh, I said, just go and check your hormones. What happens when, as you and I know you've talked about this in the past, you get your results back and everything looks normal. Nothing is highlighted, nothing is bolded out of range or whatever. What does one do at that point? Because you had pointed out to us that it's actually not normal.
Right.
But what does a woman do at that point? Because you look at it, oh, yep, the doctor may say, yep, everything's normal, everything is good, but I really don't feel good. I still don't feel right.
So you have to find somebody who deals with hormones all the time. Like that. Here in the States, they call them functional doctors. I mean, I don't know why it requires a different title. They call it functional medicine. I mean, all of medicine is supposed to be functional. But you need to find a doctor who just deals with hormones. And I work with BioT because as an internist, I also have the backative of a lot of obstetricians, because there are some things that are going to become kind of obstetric and be on that fence. And I need to have the ability to bounce some of that stuff off of an obstetrician. So with this company, BioT, the BioT is not the pellet, actually. The BioT is the community, and it really is the formula to dose the pellet. That's what BioT really is, right? And once something kind of goes outside of the norm of medicine, you likely will get a call from BioT saying, like, what, that's kind of strange. Why did you do that? Like, can you explain? And as doctors, we do need that. We need to have that ability with each other to be questioned, or to just say, like, listen, here's another way. Or so being in that company kind of helps foster that, right? And that's that's unfortunate. That's a part of the patient journey. Not all doctors are equal, and not all doctors appreciate being called out sometimes, or said that, being told that, like, okay, that there's a different way, or maybe you're wrong. So you just have to find that doctor,
Okay, well, we know that you're that doctor. So on the closing note here, I know you go to Trinidad, and you also you come to Jamaica. You want to just give us a quick, how often do you come to Jamaica, or what's your plan to do that? So if somebody wants to get on the journey with you, they want consistency.
Yeah, so Jamaica, if they go on the website, I have all the dates that I'm going to be in Jamaica. As it stands now, that may change, because yes, I am going to Trinidad as well. So I'm probably going to have to alternate some of those in Trinidad. But the next time I'm going to be in Jamaica will be on the 31st. And I do the blood work as a part of the consultation, and it's much cheaper. I get a very good rate for BioT for the lab work. So I come to Jamaica, I take the blood work, and I carry it up here. And it gives you a very thorough look at your vitamin D, your vitamin B, your hormones, and it allows me to have like a proper conversation about what's going on the inside.
Okay, that helps a lot. That's great. So if ladies, Dr. Van Horne is coming at the end of the month, so mark your calendars, August 31st, without a doubt. That's amazing. Well, no more questions. I don't want to keep up much of your time, because I know you have patients to go and see. So I do appreciate, again, this has been a fabulous discussion on getting real, talking about it, and helping everybody. So thank you so much for sharing your time with us.
Thank you for having me. All right, guys.
All right, ladies. Bye.
All right, Natalie. I'm going to talk to you soon. Bye.
Yeah, man, for sure.